Regarding adenocarcinoma, it's most common lung cancer in women and non-smoker. يعني تكون الtypical case مالتها تجي female و non-smoker. It typically present as peripheral mass with characteristic gland formation. يعني اللوكيشن مالتها يكون more peripheral على عكس السكويموس small cell اللي تكون centrally located. Grow more slowly than squamous cell cancer but tend to metastasize earlier. يعني الجروث مالتها slow locally بس تسوينا early metastasis ممكن at the time of presentation. البريكانسر lesion or precancerous lesion اسمها atypical adenomatous hyperplasia. شلون عندنا squamous cell cancer البريكانسرous lesion مالتها squamous dysplasia، هنا عندنا atypical adenomatous hyperplasia which characterized by cuboidal or low columnar cell demonstrate cytological atypia. Atypia معناته abnormal cellular features such as nuclear hyperchromasia, pleomorphism, different number and size of cell, and prominent nucleoli. In this type of cancer we have a mutation in oncogenes such as a mutation in KRAS gene or EGFR gene. This microscopic feature of adenocarcinoma demonstrates gland formation and this picture demonstrates adenocarcinoma that is positive for thyroid transcription factor 1. Regarding the case, we have 45-year-old woman has developed cough with blood-streaked sputum and weight loss. Ultrasound examination showed renal stone, bone pain and osteoporosis. Chest X-ray revealed a 6 cm consolidated area at periphery of the lung. Fine needle aspiration examination reveals malignant cells. What are the differential diagnoses? بالhistory عندنا 45-year-old woman complains of hemoptysis and weight loss. She also complains of pain, bone pain and osteoporosis. بالانفستيجيشن سوولها ultrasound شافوا عندها renal stone وسوولها chest x-ray شافوا عندها 6 cm lesion وين موجودة بالبريفري of the lung هاي. سوولها cytology يعني اخذوا sample من الليجن وشافوا السيل مالته طلعت malignant cell. What are the differential diagnoses؟ من الهيستوري هي old age woman عندها hemoptysis, weight loss, sign and symptom of paraneoplastic syndrome characterized by hypercalcemia اللي هي renal stones, bone pain and osteoporosis. Fine needle aspiration reveal the presence of malignant cell. ينطينا hint إنه هاي الليجن اللي باللنج هي malignant lesion، لذلك differential diagnosis ينحصر بالmalignancy. هاي الليجن قد تكون adenocarcinoma، قد تكون squamous cell carcinoma، قد تكون small cell or large cell lung cancer. But what are the most common differential diagnoses؟ most common هي adenocarcinoma and large cell lung cancer. ليش؟ بسبب الموقع مالتها at the periphery of the lung. What is the cause of bone pain and osteoporosis؟ مثل ما قلنا عندنا تيومر. ايش راح يفرز لنا باراثايرويد هرمون related peptide. باراثايرويد هرمون related peptide يشتغل مثل شغل الباراثايرويد هرمون. ايش راح يسوي لنا bone resorption. البون resorption معناته destruction of bone by osteoclast and release calcium into the circulation. فايش راح يصير عندنا؟ راح يصير عندنا هايبر كالسيمي. الريزلت مال بون resorption راح يسوي لنا bone pain و osteoporosis. وبنفس الوقت راح يزيد excretion of calcium in the urine فراح يصير more susceptible to renal stone. What is the name of this syndrome؟ اسمه paraneoplastic syndrome. Result from ectopic secretion of parathyroid hormone related peptide from the tumor. What is the microscopical finding of most common type؟ احنا قلنا ال most common differential diagnosis هو either adenocarcinoma or large cell lung cancer لأن دول اثنيناتهم located at the periphery of the lung. The microscopic feature of adenocarcinoma هي عبارة عن glands formation. هاي ال glands in addition to the presence of malignant feature. شنو هي malignant feature؟ قد تكون hyperchromasia of nuclei, pleomorphism, increased mitotic activity, increased nuclear to cytoplasmic ratio, etc. Regarding large cell lung cancer, these cancer are poorly differentiated يعني ما عندها شكل معين. قسم يفترضون إنه large cell lung cancer هي poorly differentiated squamous cell carcinoma or adenocarcinoma وتطلع بشكل large nuclei with prominent nucleoli. Regarding small cell lung cancer, it is considered as the most aggressive lung cancer. يعني هذا النوع من الكارسينوما يكون dangerous metastasized widely and cannot be resected by surgery. This type is strongly associated with cigarette smoking and tend to occur centrally at the central of the lung near the hilum. Regarding characteristic histological feature, it occurs in form of nests or clusters of small cells oat-like يعني تشبه حبوب الشوفان. This cell has scant cytoplasm and hyperchromatic nuclei. The small cell lung cancer is poorly differentiated, has no squamous or glandular differentiation. The size of squamous cancer cell is about twice the size of resting lymphocytes. Small cell carcinoma is associated with a mutation of tumor suppressor gene such as RB gene and P53 gene. Small cell lung cancer tend to cause paraneoplastic syndrome because it consists of neuroendocrine cells that secrete ectopic hormones. The most common paraneoplastic syndrome occur in association with small cell lung cancer include ACTH hormone secretion that cause Cushing syndrome, antidiuretic hormone secretion that cause syndrome of inappropriate antidiuretic hormone secretion, and autoantibody production that will cause Lambert-Eaton myasthenic syndrome. حتى تحفظوها للسهولة حفظوا 3A. Regarding the case, we have 58-year-old man has developed cough with blood-streaked sputum and weight loss. On physical examination, he has moon face, obese and purple abdominal striae. A chest X-ray reveals a 5 cm consolidated area near the right hilum with lymph node enlargements. Multiple hepatic nodules by sonar examination. A sputum cytology reveals the presence of clusters of small cells having large hyperchromatic pleomorphic nuclei with scanty cytoplasm but are larger than lymphocytes. What is the most appropriate diagnosis? So in this case we have old age man complains of hemoptysis and weight loss. On examination he has the sign and symptom of Cushing syndrome. On examination he has 5 cm consolidated area located centrally near the right hilum and also lymph node involvement. Ultrasound revealed the presence of hepatic metastasis, revealed the presence of multiple hepatic nodules. On cytological examination of sputum, demonstrate the histological features of small cell lung cancer. So the most likely diagnosis is small cell lung carcinoma. What are the method of spread? This tumor is metastasized to the liver by hematogenous spread from the lung to the heart by pulmonary vein and from the heart to the liver by aorta and portal vein. What is the syndrome that occur in this case? In this case, we have a sign and symptoms of Cushing syndrome, which is a paraneoplastic syndrome result from ectopic ACTH hormone secretion, adrenocorticotropic hormone secretion. So the patient has a moon face, obese, and purple abdominal striae. A stage of this case and the treatments. Because the patient has hepatic metastasis يعني multiple hepatic nodule يعني تيومر منتقل للليفر، فهذا نعتبره stage 4 اللي هو metastasis. And the treatment stage 4 is treated by chemotherapy and radiotherapy. What is the most common gene mutation? The most common gene mutation is a mutation in tumor suppressor gene called RPG. Thank you for your listening.